Good morning, everybody. This is Dr. Fateh. Thank you for sending your question to us. I'm going to go over the first few questions. Then it will go to Dr. Hala and Dr. Nadine. The first question I have, are thyroid disorders hereditary? So in general, thyroid disease is very common, and many people may have different kind of thyroid disease. The three main topic or three different kind of thyroid disease can be categorized either a thyroid mass / thyroid tumor, underactive thyroid or overactive thyroid. These are the main three conditions of thyroid disease. So in general, we see clusters of thyroid disease in the family. So we see it many times in the same family, and it may come differently. Like the mother may have thyroid nodule, a thyroid mass, and then her daughter may have underactive thyroid, and her other daughter will have overactive thyroid. But the disease runs in family. It's somehow linked to genetics and some component linked to environment. Usually, we ask patients if they have thyroid disease, we alert them there's a good chance the daughters of the patient may have the disease. The disease tends to run more in women 4:1 in ratio compared to men. So just to summarize, part of it is hereditary, part of it is environmental, and the disease tends to run in cluster among family. This is the first question. The second question I have, should I be concerned about any changes in my menstrual cycles, libido, or sexual function? The thyroid gland is one of the most important glands in the body. Thyroid hormone is important for our survival, and it has multi-role in our body. If any disturbance in the thyroid hormone may affect the cycle regularity. And in fact, if you go to your women doctor and you report to her irregular cycle, one of the first tests she will do for you is the thyroid hormone assessment. So yeah, the thyroid hormone may affect your cycles. In terms of libido or sexual function, we see that sometimes if you have underactive thyroid to the point you become you lose your energy, it may cause some depression, and that may affect your libido. Or if your thyroid hormone is quite high, where it may affect the concentration of the sex hormone in the body and may lead to low sex drive, particularly in men that we see. But a thyroid nodule, which is the third item in the thyroid disease, usually does not cause any change in your cycles, libido, or sexual function. I'll move to Dr. Hala right now.
Thank you for sending us very interesting questions. So I've got one. How can I manage hormonal imbalances or deficiencies that affect my health? So when it comes to thyroid hormone disorders, as Dr. Fateh mentioned, we can either have a hypofunctioning thyroid or a hyperfunctioning thyroid. When the thyroid hormone is less than required, then this would affect our health in different ways. Patients may complain of weight gain, cold intolerance, they may have fatigue or tiredness, they may have constipation, and of course they may have irregularities in their menstrual cycle and even heavy menstrual cycle. On the other hand, when we have a hyperfunctioning thyroid, this would present as tachycardia or palpitation, feeling nervousness, irritability, having diarrhea, and even the menstrual cycle may be irregular and may be light occasionally. So how can we manage? It really depends on what is the cause for this thyroid hormone imbalance. For instance, in both cases, the most common cause is an autoimmune disorder where our own immune system provokes this condition. And if we have a hypothyroid condition, then definitely thyroid hormone replacement is the key, and periodic monitoring of thyroid tests to make sure that the dose is appropriate. When it comes to a hyperfunctioning thyroid, there are different options, again, depending on what the cause is. Sometimes if it is thyroiditis, which is just an inflammation of the thyroid, we don't really need to give any therapy for it. We just have to monitor and symptomatically treat it. On the other hand, if the cause is a familial or a nodular or a multinodular cause, then we may resort to either anti-thyroid treatment, or sometimes we need definitive therapy such as radioiodine or thyroidectomy. With regards to the second questions, I guess I've answered that. What are the treatment options for hormonal imbalances for both male and female? It doesn't really matter the gender. In both cases, the treatment is going to be the same. But as Dr. Fatah mentioned, thyroid disorders are far more common in women, especially in the reproductive and the middle age group. Thank you.
Okay, now moving to me, I'm going to cover the nutrition role. What role does nutrition play in managing thyroid issues? Well, nutrition has a good role in managing thyroid issues. Thyroid is like a gland, just like any gland in our system, and it needs proper nutrition. Now we're moving into whole food diet versus processed food diet. So the more whole food you eat, the better your thyroid issues might go down. So that also depends on how you're eating, the lifestyle you're following, the exercise you're doing, how much water you're having. All of this does affect your thyroid issues. On the top of that, nutrition is really important when it comes to the variety of food we're eating. So it's very important to eat an anti-inflammatory diet, like, for example, fruits and vegetables, whole grains, less processed grains. Then fresh meat, hormone-free meat, and then we can go to of course dairy, and good quality of dairy is very important for our thyroid. The second question is very interesting, and there's little research on it. Is there a specific type of diet, example gluten-free or low-carb diet, that I should follow? A female 43-year-old diagnosed with SLE. So basically, a gluten-free diet, there's only like a small study talking about a gluten-free diet on women. The study is around like 43 or 34 subjects, something very little, that a gluten-free diet that has helped those patients with hypothyroidism. However, when you stop gluten, you basically stop most of the processed food you're eating. So it goes to the same area when we're talking about the anti-inflammatory diet. So basically, a gluten-free diet, you stop cakes, you stop biscuits, the processed bread, all of that. We cannot recommend a gluten-free diet as there's no enough data on that. However, if you are willing to follow a gluten-free diet, I would definitely suggest you go for whole grain. For the low carb, I would definitely recommend a low sugar diet versus low carb diet. Low sugar means you stop all refined grains, all refined sugar that causes inflammation in our system, and it's one of the causes that not only autoimmune system in our thyroid, it's also many autoimmune diseases are related to this high sugar intake in our food. So the next question is there a diet to follow to naturally balance your hormones? So basically, as we were saying before, the anti-inflammatory diet or the whole food concept, the lifestyle medicine that we're now following is the best approach to reduce or balance your hormonal issues, whether you have PCOS, whether you have thyroid issues, whether you have estrogen, progesterone imbalances. Well, a diet does affect, as well as stress, of course. So eating healthy, losing weight, having a healthy lifestyle will definitely balance your hormonal cycles in your system. So specific foods, so concerning specific foods for thyroid, there is a lot of talk about the cruciferous vegetables. Also, there's very little studies on that. And cruciferous vegetables, we need to eat a huge amount of cruciferous vegetables in order to affect the hypothyroidism. So as for cruciferous vegetables, in a normal diet, it does not affect your thyroid problem. And for as iodine as well, in a normal diet, iodine will not cause a hyper or hypothyroidism unless you're exceeding the recommended dose. The normal iodine in your diet will not affect your thyroid issues. So is there a connection between my diet and hormonal health? Well, we've asked that before. There's a connection, as we said, the anti-inflammatory diet, managing your lifestyle, losing weight. Losing weight is very important to control your hormones and your hormonal cycles and stay healthy.
Okay, next question for me. Thank you so much. Okay, so the next question for me, how often should I have my hormone level checked and what tests will be done for male and female? So we start to say there are many hormones in our body. It's not only the thyroid. So I'm going to answer this question, assume the one who asked was asking about the thyroid hormone. So generally we don't routinely screen people for underactive or overactive thyroid without symptoms, except at birth. So our babies, when they are born, they are, at least in the United States, and I believe it's the same here in UAE, they will be routinely, all of them screened. Usually they take a prick of blood from the bottom of the feet and check them for multiple diseases. One of them is the thyroid, to ensure they don't have underactive thyroid at birth. The thyroid gland is very essential for growth of the brain and the body during this very crucial period of life. Moving forward, during our childhood and adulthood, usually we don't routinely check the thyroid hormone. The pediatrician will not check the thyroid hormone routinely for the kid, neither your primary care physician, unless you come up with, or you come with symptoms such as what Dr. Hala mentioned, like irregular cycle, fatigue, constipation, overactive thyroid, palpitation, your heart beating fast, you're losing weight quickly, you're gaining weight quickly. I suggest if you have any abnormal symptoms, usually it's better to discuss with your primary doctor or your endocrinologist, and he will determine. And most of the time we are lead to do a thyroid hormone for most patients because the thyroid gland may affect you differently from one person to another. If I want to answer in general, back to the same question, how often should I have my hormones levels checked? Assuming here I'm talking about all the hormones. Again, you should need some symptoms. So when you present your case to your doctor, he will determine which group of hormones should be tested to better serve you and diagnose you properly. The second question I have, it says, this is a very specific question. What happens if I get pregnant? The patient is a female diagnosed with a rare disease called SLE, and the age is 40 years plus. So women, when they get pregnant, again, we are talking about the thyroid gland. Some of the women with lupus are more prone for abortion or miscarriage, And those women usually check for the thyroid hormone and the antibody, and based on their titers of the thyroid antibodies, if they are present, and if the thyroid hormone level is low, which means the TSH level is high, the doctor may recommend to start them on treatment to decrease the risk of miscarriages. I'm gonna move now. I think I answered all my questions. I'll move the questions to Dr. Hala.
So basically, I've got a very interesting question asking if stress or anxiety can affect my hormonal balances and how can I reduce their impact on my health. Well, basically, if we want to tackle this question, we have to really differentiate. There's first the acute stress, where the patient is in an acute illness or is in a critical care unit or have a severe infection. We expect in these patients that they will have some thyroid function test abnormalities that may appear if we test their thyroid function test labs. And these kind of physiological, that happens as a kind of protection to help them during this acute illness. That's why we usually do not check for these tests in any acute illness, and we would rather wait for 8 to 12 weeks later if we're suspecting thyroid disorders and check for it then. Now, as for chronic stress in general will elevate a hormone which is called the cortisol hormone, and this definitely increases the inflammation in our body and increases many chronic diseases. However, with regards to the thyroid, definitely it may affect us and it may provoke the appearance of certain thyroid disorders, especially if the patient is genetically predisposed or have a hereditary condition or they're already diagnosed with thyroid disorders. This condition may progress further with the chronic stress. How can I reduce that? Well, basically we need to adopt some lifestyle changes that will help to reduce the stress, such as yoga, exercise, meditation. I guess it really varies from one person to another. Some people reduce stress by doing certain activities that they like, and definitely try to do as much as possible anything that may reduce your stress level, because this will affect your health in different ways. The other question I got was how to optimize female and male hormone health. So basically, to answer this question, if we're basically targeting the thyroid hormone specifically, we need to get screened or tested for thyroid disorders if we do have any symptoms suggestive of thyroid dysfunction, because it's very important to diagnose and treat as early as possible in order to help preventing getting the complications of diseases, of this thyroid diseases. However, in general, I would suggest adopting a healthy lifestyle, having a stress-free environment, trying to have a proper iodine supplementation. We usually need a certain amount of iodine per day. We should not exceed that. And basically having exercise and healthy lifestyle. I'm not sure Dr. Falah would like to add anything about options to optimize female and male health.
I agree with Dr. Hala. She answered quite well. Focusing on lifestyle, activity, reduce risk, optimize weight. I agree with you, Dr. Hala. This would be the best answer.
Okay, so I have a question. Can herbal medicines or supplements help, or is it safe to take them with prescribed medications? If you're talking about herbal medicines in general, it really depends on which one you're talking about. Usually, I often tell my patients, we need to have data and studies proving the efficacy and safety of whatever you're taking. That's why when we opt to treat, we often give the patient the evidence behind it. What's the efficacy? What are the risk factors of using such a medicine? For the thyroid specifically, some patients tell me about the kelp use. Well, basically, if they're taking a very high dose of kelp, which has a lot of iodine and selenium in it, I wouldn't recommend, because taking iodine or selenium over the requirements would basically provoke more thyroid disorders or would worsen an existing thyroid condition.
Yes, doctor, I agree with that. Selenium is very important. You can get selenium by eating one Brazil nut only.
Wow.
So the recommended selenium is 50 microgram. However, one Brazil nut has 90 microgram of selenium. So yeah, food is our supplement. So yeah, but eating too much selenium, eating too much iodine, as we said before, it might induce hyper or even hypothyroidism, which is not really recommended. So yeah, don't put a lot of salt in your diet. Use iodized salt, just don't overdo it. Don't use iodine pills until or iodine supplements. Don't use herbal supplements like you buy from the market or online. Even if it writes hormonal balance and stuff like that, without getting back to us, getting back to your doctors, checking your hormonal health before taking those supplements. Even the multivitamin, doctor, do you agree? Even
yeah,
the
I totally
multivitamin,
agree with that.
guys, yeah, please just do your test first. Ask your doctor even before taking any multivitamin like you would wish to take. Yeah. So, are there any specific food that can help improve thyroid function or balance hormone? So the specific foods, as we mentioned earlier, you can use Brazil nut, just 1 to 2 pieces a day. Just be careful around the calories. If you have weight gain and you're planning like to lose weight, one Brazil nut has around 30 to 40 calories per piece. One nut.
Wow.
Yeah, it's too much. So you can definitely use Brazil nuts, healthy nuts, like in moderate quantity. Go to your fruits and vegetables, as we said earlier. Don't drink. One thing that I was preparing for this talk, one thing that passed through my head, that some people do a lot of green juices, right? And if you're using a lot of cruciferous vegetables and you're over juicing, then you're taking too much from the cruciferous vegetables that might affect negatively your hormonal balance and your thyroid balance. So this is very important to keep in mind. Just do things in moderation. Just don't do juice diet, kale in the blender. Just do moderate amount of vegetables, moderate amount of fruits. This will help you to balance your hormonal your hormones. What we said also, selenium, iodine. For thyroid, iodine is also found in seafood. So guys, if you eat a lot of seafood 3-4 times a week, it is really recommended. Just don't do it over pills. This is very, very important.
So what are the signs of hormonal imbalances? As we've mentioned, if the patient is suspected of having hypothyroidism or a low functioning of the thyroid, patients may notice that they're gaining weight or having difficulty losing weight. They may have very thin and brittle hair. They may have a dryness in their skin, constipation, irregularities in the menstrual cycle in females. And also they may suffer from constipation or having difficulties in the gastrointestinal system. When it comes to hyperthyroidism, you may suspect that you have this condition if you're really having palpitation or increased heart rate, increased tremor, anxiety, being more irritable, having light cycles in females, and even having diarrhea or unexplained weight loss. So these are the situations where you have to suspect that you could be suffering from a thyroid disorder. It's better to have your thyroid tests being checked.
Okay, this question say, the question here say, could thyroid medication affect my ability to become pregnant or have children? So the thyroid hormones are two types mainly. One is to increase your thyroid hormone level is already low, and you take a supplement which called euthyrox or levothyroxine to bring your thyroid hormone level to the normal range. And the other side of the spectrum, your thyroid hormone level is high, and you need to reduce your thyroid hormone to the normal range. In both conditions, under medical supervision, the treatment actually will improve the patient ability to conceive and having baby. Nevertheless, this needs to be done by a doctor because either under treatment or over treatment will impact your ability to have a baby. But giving the right dosage of medicine, in fact, it will improve your fertility and increase your chance of having the baby. The levothyroxine, which is the most common medicine, is extremely safe for pregnant women. And in fact, if the woman has underactive thyroid, she receives the thyroid hormone and she doesn't take it during pregnancy, it will impact the pregnancy negatively. Similarly, when the thyroid hormone level is high, at certain time, the doctor may choose one medicine to reduce the hormone. If the patient doesn't take the medicine, it may impact the pregnancy outcome. Nevertheless, again, the overactive thyroid, they have a specific medication that need to be tailored. As the overactive medication, some of them, they may induce congenital anomalies. So this always should be done under medical supervision.
Yeah, I would like to add something with that. That's why any woman with thyroid disorders, we often advise them before they even become pregnant to have their thyroid function test tested and to be sure that they are euthyroid and the tests are okay before they actually go into pregnancy, and to monitor it periodically throughout their pregnancy. I've got a question. At what age do we need to check our thyroid and how often? So Dr. Fateh mentioned that we don't really need to screen for thyroid. There's nothing like that. However, if you have symptoms suggestive of thyroid disorders, or if you have a strong family history, then probably having a TSH checked is good. And if it is abnormal, then further thyroid tests should be done in order to check the condition that led to this disorder. And how often, if someone is already diagnosed with thyroid disorder and they're already on medications, then we usually recommend every 3 to 6 months to have their thyroid test checked again, just to see if they need any adjustment in the dose and to see if there's anything else to be done. If on exam the patient is suspected to have thyroid nodules, we need to do an ultrasound of the thyroid to check their sizes and how many they are in order to decide on the further management. Okay. So we've got a question. What's the long-term outlook for patients with thyroid disorders? If you want to start on that.
Sure. So again, the thyroid diseases are wide spectrum. So we have the thyroid nodule, we have the underactive thyroid, we have the overactive thyroid, and God forbid, thyroid cancer. So the most common is the underactive thyroid and overactive thyroid gland diseases, and both are easily controlled, easily treated, and they have a long survival. The disease does not impact their survival rate or ability to conceive if the condition is treated. I'll leave the other part to Dr. Hala, thyroid nodules and thyroid cancers.
Yeah, so basically, as Dr. Fateh said, it depends really on the condition. But usually patients with thyroid disorders need to be monitored chronically for a very, very long time. If the patient have thyroid nodules, we often recommend ultrasound thyroid. It depends on the kind of those nodules. We may recommend too often, or we may recommend once every year or every 2 years in order to follow up on the nodule size. If the patient has thyroid cancer and they've already underwent total thyroidectomy and they've got treated for it, they need to do thyroid tests every 3 months. They need to check thyroglobulin to monitor for this cancer remission every 6 months, and probably ultrasound thyroid in the ultrasound neck in the first few years on a yearly basis. So I guess, yeah, they need long-term follow-up.
We are focusing about the thyroid here. We're not talking about all the hormones. Your body produces many different hormones, but the most important or common one, I would say, is the thyroid gland.
So again, I've got a similar question. What are the symptoms that I need to look out for? Look for any weight changes, unexplained weight loss or weight gain. Look for any changes in your hair or in your skin, like dryness in your skin or dry and brittle hair. Look for any irregularities in the menstrual cycle and have the thyroid tested to check if it is the cause for this abnormality. Look for any gastrointestinal problems like constipation or diarrhea. Some people with thyroid disorders may complain either of having cold intolerance, they don't like the cold weather, or heat intolerance. People may get a tremor or feel mood changes. Thyroid disorders is often associated with mood changes. For instance, having hypothyroidism may increase the symptoms of depression and low mood. On the other hand, having hyperthyroidism may increase the chance of us having anxiety and irritability in the disorders. So basically, the thyroid hormone affects all our body, all the way from head to toes. It affects our body metabolism. It affects our heart rate. It affects our gastrointestinal system. So any abnormal symptoms that appear with regards to those systems, definitely have your thyroid checked. Sometimes it will be abnormal and it will be the cause. At other times it may be something else. But it's good to have your thyroid test if you have any of these signs or symptoms.
So what are the foods that we need to avoid? So basically we need to avoid sugar, as we said before, desserts, processed foods like chocolate bars, chips, snacks, pretzels, everything that has food colorings, including also juices. We need to avoid all types of hydrogenated fats, palm oils, and vegetable oils, because these also increase inflammation in our system. Types of fats that are rich in omega-3 versus omega-6 versus omega-3. So all types of like soy oil, corn oil, all of these types of oil, it's better that you switch them with olive oil, which is naturally high in antioxidants. Also, you need to stay away from deep frying while cooking. It's very important that all types of meals that you prepare in your kitchen needs to be air fried or oven baked instead of deep fried or pan fried. Also, we need to look at the type of sugar you use in your food. You can use honey, definitely, but good quality of honey. You can use agave syrup, you can use maple syrup, but the good quality ones, the organic ones, better than the ones that has high fructose corn syrups or glucose, like a quick sugar that's quickly absorbed, because these might also cause inflammation.
So just to summarize and give you an overall view, so basically thyroid disorders are pretty common, more in women than in men, especially in the middle age group. The thyroid disorders could be many, from function abnormalities to having nodules to having thyroid cancer. It's better if you have any symptoms suggestive of thyroid disorder, just be on the safe side, have it tested, and get diagnosed and treated accordingly.
I agree with Dr. Hala. Any question about, please feel free to go back to your primary care physician or to an endocrinologist to answer your questions. thyroid disease are curable and treatable, and one of the few easiest disease where we can make really significant impact on patient care.
Okay, as for me, please, if you have weight issues, go back to your dietitians. Let's do a healthy diet plan, lifestyle modification, changing in behaviors and habits that will help you lose weight, because losing weight, as we said before, will definitely balance your hormones, and stay healthy.
Have a good day.
Thank you.
Thank you.
Thank you.
Okay.
We have a good number for it.
I did it.
That's good.